Good afternoon, Poulin Handspring. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. You can now start your OET speaking roleplay.
Thank you, Mihiraa, for allowing me to examine your child. I completely understand your concern. It's always frightening to see your child get hurt. I want to reassure you that from my initial assessment, Kevin's injury appears to be a very common and minor scrape on his knee. It's what we call a superficial injury, which means it's just a small break in the top layer of the skin. There's no need for stitches, and it should heal up nicely. To help me understand what happened, could you tell me a little more about the fall itself?
He was at the top of the slide, and he kind of lost his balance and just slid off the side. He landed on his hands and knees. He didn't seem to hit anything hard, just the ground. He cried a lot at first, but he calmed down after a few minutes when I picked him up. He says his knee hurts, but he's already back to running around a bit, so I guess the pain is mild now.
It's good that he's active again. That's a positive sign. Before you brought him in, what did you do for his knee? Did you try any first aid at home, or did you put anything on the wound?
I just got a tissue and cleaned the blood away. I didn't want to use anything on it in case it would make it worse. I did tell him to be brave and not cry. I'm just so worried about it getting infected.
Mihiraa, let me walk you through what we're looking at with this wound. From my assessment, it appears to be a minor skin break, superficial, with no deep damage to muscles, bones, or underlying tissues. I've also checked carefully, and there are no foreign objects like dirt or debris left in the wound, which is good news. This means the healing process should be straightforward with proper care. Next, we'll focus on making sure the wound stays clean and protected. I'll start by gently cleaning it with a saline solution to remove any bacteria and reduce the risk of infection. Once it's thoroughly cleaned, I'll apply an appropriate dressing to keep it covered and promote healing. I'll also give you clear instructions on how to care for it at home, like when to change the dressing, signs of infection to watch for, and how to keep the area dry and protected. Most importantly, I want to make sure you feel comfortable and informed. Do you have any questions or concerns about the wound, the cleaning process, or the care instructions?
That sounds good. What if it gets infected? What should I look out for?
You're asking a very important question. Mihiraa, I want to reassure you that your child is doing well overall. From what I can see, they're active, alert, and responding normally. All very good signs. There are no indications of any serious injury or immediate cause for concern. Children are remarkably resilient, and based on my assessment, this appears to be a minor issue that we can manage with some simple care and observation. To ensure everything stays on track, I recommend keeping a gentle eye on their behavior over the next 24 to 48 hours. Look for their usual levels of energy, appetite, and comfort. Any significant changes in these areas would be worth noting. Your child's well-being is the priority, and everything I've observed suggests they're going to be just fine.
Okay, I'll go with your suggestion. By the way, I'm a bit confused about wound care at home. Could you help me understand it better?
Mihiraa, let me walk you through how to care for this wound at home so it heals well. The most important things to remember are keeping the area clean and dry. This means gently washing it with mild soap and water once or twice daily, then patting it dry carefully. Try to avoid getting the wound soaked in water for long periods, so shorter showers are better than baths for now. You'll want to change the dressing regularly, ideally once a day, or whenever it gets wet or dirty. When applying a new dressing, make sure your hands are clean and the area is completely dry first. Mihiraa, do you have any other questions about the home care for his knee?
Thank you, that's really helpful. When should I bring him back for the follow-up checkup?
That's a great question. You will not need a follow-up appointment, but it is important to know when to seek further medical attention. You should bring him back to the hospital or see a doctor if you notice that the wound worsens or if he experiences severe pain. Also, if he develops a fever or becomes drowsy or unresponsive, those are signs that something more serious could be going on, and you should seek medical attention immediately. Does that make sense?
Yes, that does. Thank you for all your help and for explaining everything so clearly. I feel much better now.
Now that we've discussed everything, are you happy for me to begin his dressing change?
Yes, I am. Thank you.